Good afternoon, everyone. We are the Group 6 and we are going to tackle about Madeleine Leininger. In this PPT, you'll know about the autobiography of the theorist, overview of the theory, and metaparadigm of the theory. Madeleine Leininger was born on July 13, 1925 at Sutton, Nebraska, US. She died on August 10, 2012. Founder of the theory of transcultural nursing or culture care theory. She is a former CEO of the American Nurses Association and was named Living Legend by the American Academy of Nursing. She is considered by some to be the Margaret Mead of nursing. She defined nursing as a learned humanistic and scientific profession and discipline which is focused on human care, phenomena, and activities in order to assist, support, facilitate, or enable individuals or groups to maintain or regain their well-being or health in culturally meaningful and beneficial ways, or to help people face handicaps or death. She is the middle child of 5. She had 2 older sisters and 2 younger brothers. She graduated at Sutton High School in 1942. She entered St. Anthony's School of Nursing in Denver, Colorado, and a member of the United States Army Nursing Corps. Madeleine Leininger Awards and Achievements. At 1948, she graduated from St. Anthony's with a diploma in nursing. At 1950, she earned a bachelor's degree from Mount St. Scholastica College in Atchison. At 1951 to 1954, she studied biology, nursing administration, curriculum, and teaching at Creighton University in Omaha, Nebraska. She earned the equivalent of a Bachelor of Science in Nursing, and she received her Master of Science in Nursing in 1954. 1954 to 1959, she is an Associate Professor of Nursing in the Child Psychiatric Nursing Program. 1955 to 1958, she studied nursing curriculum and the social sciences at University of Cincinnati. 1960, she began her doctoral studies. 1966, she received a PhD in cultural and social anthropology from the University of Washington, and she was the first nurse to achieve this honor. 1966 to 1969, after receiving her PhD, she joined the faculty of the University of Colorado, where she taught in the College of Nursing and the Department of Anthropology and was the director of the Nurse Scientist Program. 1969 to 1974, she was a dean and a professor of nursing and lecturer in the Department of Anthropology at the University of Washington. 1974 to 1981, she held various positions at the University of Utah, including Dean and Professor of Nursing, Professor of Anthropology, and Director of the Center for Nursing Research and the Doctoral and Transcultural Nursing Programs, and she established the Transcultural Nursing Society. 1981 to 1995, she was a Professor of Nursing, Professor of Anthropology, and Director of the Transcultural Nursing Program and the Center for Health Research. 1995, even though she was semi-retired, she was still very active in teaching and promoting her work. Her other awards were Professor Emeritus at Wayne State University, Professor Emeritus at the University of Nebraska School of Nursing. She was awarded honorary degrees from Benedictine College, the University of Indianapolis, and the University of Kuopio in Finland. She was a Fellow of the American Academy of Nursing, a Distinguished Fellow of the Royal College of Nursing in Australia, and a member of the Honor Society of Nursing Sigma Theta Tau International. And in 1998, she was named as a living legend by the American Academy of Nursing.
Overview of the theory. The Transcultural Nursing Theory, or Cultural Care Theory, by Madeleine Leininger, involves knowing and understanding different cultures with respect to nursing and health illness caring practices, beliefs, and values, with the goal to provide meaningful and efficacious nursing care services to people according to their cultural values and health illness context. It focuses on the fact that different cultures have different caring behaviors and different health and illness values, beliefs, and patterns of behaviors. It essentially incorporates culture into the nursing sciences so as to be more inclusive with different cultures around the world. The main focus of Leininger's theory is for the nursing care to fit with or have beneficial meaning and health outcomes for people of different or similar cultural backgrounds. Description. In 1995, Madeleine Leininger defined transcultural nursing as a, quote, substantive area of study and practice focused on comparative cultural care, values, beliefs, and practices of individual or groups of similar or different cultures with the goal of providing cultural, specific, and universal nursing care practices and promoting health or well-being or to help people to face unfavorable human conditions, illness, or death in culturally meaningful ways. Major concepts of the transcultural nursing theory. The following are the major concepts and their definition in Madeleine Leininger's transcultural nursing theory. Transcultural nursing. Transcultural nursing is defined as a learned subfield or branch of nursing which focuses upon the comparative study and analysis of culture with respect to nursing and health illness, caring practices, beliefs, and values with the goal to provide meaningful and efficacious nursing care services to people according to their cultural values and health illness context. Ethno-nursing. This is the study of nursing care beliefs, values, and practices as cognitively perceived and known by designated culture through their direct experience, beliefs, and value system. Nursing. Nursing is defined as a learned humanistic and scientific profession and discipline, which is focused on human care phenomena and activities in order to assist, support, facilitate, or enable individuals or groups to maintain or regain their well-being in culturally meaningful and beneficial ways, or to help people face handicaps or death. Professional nursing care. Professional nursing care is defined as formal and cognitively learned professional care knowledge and practice skills obtained through educational institutions that are used to provide assistive, supportive, enabling, or facilitative acts to or for another individual or group in order to improve a human health condition, disability, lifeway, or to work with dying clients. Cultural congruent nursing care. Cultural congruent nursing care is defined as those cognitively based assistive, supportive, facilitative, or enabling acts or decisions that are tailor-made to fit with individuals, group, or institutional cultural values, beliefs, and lifeways in order to provide or support meaningful, beneficial, and satisfying healthcare or well-being services. Health. It is a state of well-being that is culturally defined, valued, and practiced, and which reflects the ability of individuals or groups to perform their daily role activities in culturally expressed, beneficial, and patterned lifeways. Human beings. Such are believed to be caring and to be capable of being concerned about the needs, well-being, and survival of others. Leininger also indicates that nursing as a caring science should focus beyond traditional nurse-patient interaction and dyads to include families, groups, communities, total cultures, and institutions. Society and environment. These terms are not defined by Leininger. She speaks instead of worldview, social structure, and environmental context. Worldview. Worldview is the way in which people look at the world or at the universe and form a picture or a value stance about the world and their lives. Cultural and social structure dimensions. Cultural and social structure dimensions are defined as involving the dynamic patterns and features of interrelated structures and organizational factors of a particular culture, subculture, or society, which includes religious, kinship, political, economic, educational, technological, and cultural values, ethno-historical factors, and how these factors may be interrelated and function to influence human behaviors in different environmental contexts. Environmental context. Environmental context is the totality of an event, situation, or particular experience that gives meaning to human expressions, interpretations, and social interactions in particular physical, ecological, social, political, and/or cultural setting. Culture. Culture is the learned, shared, and transmitted values, beliefs, norms, and life ways of a particular group that guides their thinking, decisions, and action in patterned ways. Culture care is defined as the subjectively and objectively learned and transmitted values, beliefs, and pattern life ways that assist, support, facilitate, or enable another individual or group to maintain their well-being, health, improve their human condition and life way, or to deal with illnesses, handicaps, or death. Diversity. Culture care diversity indicates the variabilities and or differences in meanings, patterns, values, life ways, or symbols of care within or between collectives that are related to assistive, supportive, or enabling human care expressions. Culture care universality. Culture care universality indicates the common, similar, or dominant uniform care meanings, pattern, values, life ways, or symbols that are manifest among many cultures and reflect assistive, supportive, facilitative, or enabling ways to help people.
Meta-paradigm of the theory. There are four basic meta-paradigm concepts of nursing. First, person. Person is the recipient for care. Second, health. Health is a state of well-being defined by the person. Next is nursing, which is the nurse's actions. And lastly, environment. Environment is the internal and external factors that affects the person's health. Leininger's meta-paradigm person and environment. Person. Humans are universally caring beings who survive in a diversity of cultures through their ability to provide universality of care in a variety of ways, according to differing cultures, needs, and settings. This includes physical, spiritual, emotional, and social aspects. Environment. It is and included events with meanings and interpretations given to them in particular physical, ecological, social-political, or cultural setting, existing forces outside the organisms, and in the context of culture. It is said that behaviors and health are influenced by culture. It is the assessment of patient's environment crucial. Leininger's meta-paradigm health and nursing. Health encompasses a broad spectrum of conditions, including well-being, illness, disability, and handicap. Health is universal across cultures, but specific to each individual culture. Nursing, a learned humanistic and scientific profession and discipline that focuses on phenomena and activities of human care in order to assist, support, facilitate, or enable individuals or groups to maintain or regain their well-being in culturally meaningful and beneficial ways. Nurses must be sensitive to beliefs, values, and practices of each culture. That's all for today. Thank you for listening.